and welcome to Geriatric Mom, the show that helps you have a voice. Real moms and dads sharing the unedited truth, finding joy in the chaos, and reminding each other we're in this together. I'm your host, Natasha, aka Geriatric Mom. This would be episode number 12 of the podcast. And for this one, I really want to focus on induction as our subject. I feel like that situation doesn't really get explained to you until, like right up until that moment when it's happening. And it would be good for you to know everything that entails, right? So for myself, induction was done because I was a high risk pregnancy and because my son had an enlarged kidney. And they didn't know why that was happening. And most of the time that resolves in the womb, and his did not, it wasn't. So they said because it had worsened, I was getting weekly ultrasounds. Because it had worsened, they felt that it was time to induce. I, in that moment, didn't really think through the whole situation. I was just scared and nervous and concerned, obviously, about my baby. And so I feel like I didn't follow up with the right parties, I guess. So we already had children's involved so that he could be seen right after he was born. They said it wasn't necessary that I was induced because it didn't matter while he was in the womb what was happening with the kidney because it wasn't affecting him. The kidneys don't fire up until 24 to 48 hours after the baby is born. So I have mixed feelings about how all of that went, right? Because I really was against being induced. I wanted to have a natural labor. We all have our ideas and plans. So I have really mixed feelings about this, but I just feel like for you, moms and dads, it's good for you to know what this means and what that looks like. So the Mayo Clinic states labor induction means getting the uterus to contract before labor begins on its own. The goal to have a vaginal birth. The main reasons for this are concerns for the baby, for the mother, or for both. They state that the reasoning for this should always be that the benefits outweigh the risks. So being induced is the most beneficial to the mom and baby, and the risks outweigh that. So I feel like when you get into the third trimester, really starting to discuss those things with your provider and have them really explain these things to you is vital. Obviously, my experience is going to be different than your experience. I just think it's good for everyone to be aware. Uh, so, one of my thoughts with this, sorry, I had to like a moment. I was trying to get my thoughts together there. But a lot of the factors for this, I think that taking a deep look into, you know, the big picture is vital for induction. So that's going to be what the baby's health is, how old the baby is, so the gestational age, what's the baby's weight, estimated, what's their estimated size, what's their position, are they breech or are they head down, what are they looking like as far as that, and other health risks like what for the mom, what risk factors does she have? Does she have gestational diabetes? Hypertension leading to preeclampsia, all of those things. So I think really looking at the big picture for the mom and the baby is really important for this. So with that, moms that have gestational diabetes that can eventually be harmful for the baby. So sometimes they'll induce for that. On average, they need to be at least 30, the baby needs to be at least 39 weeks. Sometimes they'll do it sooner if they need to, but 39 weeks is kind of their gold standard. Sometimes they'll do induction if the baby starts to, if they feel like it's going to be a really large baby, they'll induce to try to prevent, like excessive weight gain for the baby. Because at some point, if the baby gets so big, there's no possible way you're giving like a natural birth because of that. So like we talked about, another reason is high blood pressure, so you can get preeclampsia or eclampsia. So preeclampsia is when there's protein in the urine, you're getting swelling. This generally starts to happen after you're 20 weeks pregnant. They usually don't see a whole lot of that before unless you've already had hypertension in your history. Eclampsia is seizures. The protein from preeclampsia can cause preterm birth, placenta abruption, and low birth weight. So those are part of the reason why it's so important to have an induction if you do have, preeclampsia. And then once it escalates to eclampsia, that's just as a medical emergency. Other reasons that they might do an induction is if you get an infection of your uterus, which, to be honest with you, I'm not super familiar with, so I'm not quite sure how they would see that. I'm guessing they might be able to see that on ultrasound or blood work, but I'm not familiar enough to know what that would look like. Um, with preeclampsia and eclampsia, you have an increased risk of heart attack and stroke, so that is part of why it's so vital that induction is considered if your blood pressures continue to rise. Other factors to consider, especially for the mom's health, is if they have any other kidney diseases, heart diseases, or if they're extremely overweight. Those can all be factors. Sometimes will induce if you've gone too far past your due date. So there are moms, especially first time moms, it's normal not to give birth at 40 weeks to actually go past that point. So anytime after 42, like at 42 weeks and beyond, is called a post-term pregnancy. So that carries its own set of issues in itself. So they'll definitely induce if you haven't given birth by 42 weeks, you will be induced. Another reason they might help do induction is if the labor doesn't happen after the water break. So, say your water broke and you're not starting to have contractions, or you're not effaced or anything like that, which we'll discuss, the cervix and how they soften that with medications. But that is another reason. Poor baby growth. So, if the baby's just really not doing well in the womb, sometimes older moms especially can have, like, older uteruses, and they don't always aren't always able to, provide what the baby needs. Obviously, they get a lot of their nutrients from the umbilical cord, but the uterus has to be able to hold the pregnancy, and, you can have an older uterus the older you get. So, that is part of that. Not enough amniotic fluid is very common. Any concerns with the placenta? Some of the research I was doing says that the placenta can start to peel away from the uterus, poor placement. You can also request to be induced. So some parents will want to know when they're going to have their baby, so they'll schedule it. So you can schedule to be induced at 39 weeks and older. They generally will not do it like if it's a request before then. But a lot of, parents, especially if they have other kids, I do understand they're like, I need to know when I need to take my kids to their grandparents, or, have a general idea of when that baby's going to be born. And I definitely feel like that's the choice of the parents of how that looks. So the goal with induction is to reduce worst case scenarios. So the goal is to reduce the chances of a stillbirth, large babies, or, hypertension issues with the mom that can lead to those serious outcomes, which are like the stroke, the heart attack, all of those severe issues. So those are really important to consider and to monitor for yourself. When I was pregnant, I monitored my blood pressure twice a day, so once in the morning and once in the evening, and kept an eye on those. I definitely had put on quite a bit of weight throughout my pregnancy. I think they told me I was expected to gain 30 pounds. I gained 70 probably, and just started losing weight, so that's been really hard. But obesity is a factor. I didn't have any gestational diabetes, I didn't have any hypertension issues, but really just taking care of yourself while you're pregnant, not only for a geriatric mom, but for any mom. You're going to want to try to eat as well as you can and really make sure you stay hydrated and try to get that rest if you can. I know that's harder obviously for parents that have multiple kids, but definitely focusing on yourself and giving yourself that extra TLC is extremely vital to all of this. Geriatric moms have a higher risk related to pre-existing conditions, so that just goes back to what I was saying, that you really need to watch yourself, especially if you do have, concerns or issues. If you have liver disease, if you have heart disease, diabetes, anything like that, it's very, very important that you take extra care of yourself while you're pregnant, because that just is pregnancy is one of the hardest things that a woman can do to her body. So with the pre-existing conditions, they're obviously more prone to geriatric moms are more prone to elevated blood pressures, gestational diabetes, complications. If you've never given birth and you're a geriatric mom, the risks are even higher. Why that is, I'm not sure, but that definitely was one of the things that I kept seeing throughout my research. So definitely keep that in mind, that geriatric mom, first time mom, though you're at a higher risk. So labor induction risks. Um, so if you fail to dilate to give birth within 24 hours or more, you may need a C-section. That is what ended up happening to me, is I had a C-section. So I think that's a very real scenario that happens a lot of times. I think especially with older moms versus, maybe younger moms, that C-section ends up happening if you're induced. So reasons that they may do the C-section if the induction fails is if there's a low fetal heart rate. So they keep the monitors on you, and they're very on it. They are constantly checking those monitors to make sure that they're in place and that they can see baby, you keep them on the monitor and that they can track them. So I think that's a huge reason, is really monitoring that heart rate and the fetal movement to see how the baby is doing. The medications that they give you can cause too many contractions, which decrease the oxygen to the baby. So that's obviously a concern, because over an extended period of time of receiving these medications, it can cause, like the low fetal heart rate and decrease that oxygen supply, which you obviously, even in the womb, need oxygen. So that's a very important and something that they pay very close attention to. Infection, rupturing the membranes cause infection, and can cause that to the mom and baby. So if they manually break your water, you can get an infection from that. So definitely important to, you know, watch that and monitor. They obviously monitor mom's vital signs really well too, but if you start feeling off, you're not feeling good, something's not right, I feel like it's always better to speak up and say, I don't feel good, so that they can do some extra checks on you if they need to, because, it's your life and it's your baby's life. Uterine eruption, most happen with multiple C-sections. So what this is, which I hadn't heard this before, but it's where the uterus tears along the C-section line. So if you've had previous C-sections before and you are in labor, you can just be in labor, not you be trying to give a vaginal birth. This is why they say that it's not always best to try to give vaginal birth after you've had a C-section, because you can literally tear along that C-section line. So that's why they generally opt to just do a C-section if you've had one before, because it is such a risk, that can tear, and that I can't even imagine how bad that would be. That would be horrible. If this happens, one of the worst case scenarios for it is that you would need a hysterectomy. Other risks, if you're induced and you have to have a C-section, you can have bleeding, so you can hemorrhage your uterine. So when you hemorrhage, your uterine muscles don't contract. And so they have to obviously find the bleed, they have to stop the bleed, and they'll give you meds to help that. So it's like a mix between surgical and oral medications that they'll give you to stop bleeding. I actually did hemorrhage as well during my C-section, so that was pretty scary, but they, like, shove these pills in your mouth, and I couldn't even stay awake, so I just had, like, these dry pills I was, like, choking on while they're trying to stop the bleeding, and I can't. So that's kinda scary, so just so you know that that is something that they can happen. They did a really good job. They were able to find the bleed and stop it, but definitely a risk with C-section. So with the uterine rupture, it says a lot of it depends on the way that the previous C-section um, cuts were made, so that can make a difference in if it tears or not. So that's important. Another issue that can cause you to need a C-section is the placenta blocking the cervix. So it did say that they would like try to move that if they needed to, but I don't even know what that would look like. So that can be another issue. The umbilical cord can prolapse and drop into the vagina. You would need a C-section for that. Your baby is breech, and there's no way of them. I've heard that, they can manually move your baby, but I've also heard that's extremely painful. Another reason for a C-section, um, if in, is if you have an active outbreak of herpes. So if you have that virus, they would not want you to give vaginal birth so you don't pass it along to the baby. So ways that they can induce you is to ripen the cervix. So ripening the cervix involves giving you medication. So they are prostaglandins, and they give you those by mouth, or they can do them vaginally. Um, so when you hear them talking, like she's 25% effaced or whatever the case may be, that's kind of what they're talking about, is softening that cervix up. Mine softened up pretty quickly. I'd say that that wasn't the issue throughout the entire process, really, maybe a little bit, but in general, my issue that led to the C-section was generally that I wasn't dilating, and I ended up, having my water broke, and then 24 hours later, I still wasn't dilating enough, so, and the baby wasn't, baby Odin wasn't doing well, so that ended in the C-section. So that's what they mean when they're talking about that. So they'll give you medications first to soften your cervix so that it allows it to be able to dilate. Another thing that they can do to try to help you dilate, which I also did, is they can place balloons in your cervix. So they'll fill two balloons. They fill them with 80 cc's of fluid, which, if you've ever seen that, is a crap ton of fluid. And one ball sits on the top of your cervix and one sits on the other side of your cervix, kind of like compressing like it was the baby's head to make your body feel like it needs to dilate. That was extremely uncomfortable. I won't lie. It was pretty painful. The goal of it is to get you to 4 centimeters, and then the balls are supposed to just kind of like fall out. Well, mine didn't, and they ended up kind of just getting pulled out, and that was extremely painful. It was probably one of the most painful things I've ever felt. So that is an option. Like I said, the goal is to get you to like 4 centimeters to kind of help push your body along in the process. They did offer another thing that was kind of similar to that, like it was like a tampon that kind of expands to try to help you dilate. The balloon, they said, was better than that, and if you do one, they won't do the other one later. So I did do the balloons. It didn't really work. So up to you on if you try these things or not, but Just a heads up. They are huge balloons with a lot of fluid. Membrane sweep, which is something that I wanted to do, but unfortunately, my doctor's office was closed when I needed my 39-week appointment, so I wasn't able to have that done. But a membrane sweep is something that they can do um, to try to separate the sac from the cervix and the uterine wall. So that can definitely help induce labor too. Like I said, they can break your water, so they'll rupture the sac. Like mine, they used like a little hook and it ruptured, and I was leaking fluid for a while. Um, they only try to do that if you're dilated, which I think when they broke my water, I was at like 5 centimeters maybe. I only ended up making it to 6 or 7. They said 7 and then went back to 6, and so it was a whole shenanigan. But they only do that if you are dilating. Another medication that they're going to use, so they'll give you the oral medications to soften your cervix, or I guess they have vaginal ones. Mine were pills, but they'll give you Pitocin. So the Pitocin goes through an IV, and it helps start your contractions. So they can kind of control how fast your contractions go and how regular they are with this medication. The goal with it is that they slowly increase it, and it's supposed to increase your contractions, making your body want to move along in the process, right? So then you're dilating more so that you can give birth. That didn't happen with me either. So the contractions got so out of control that I literally was just having nonstop contractions, and there was like no break in between. And so that's really wearing on the mom as well as the baby. So that can be hard and difficult too. I did end up getting an epidural when I started the Pitocin. I was really upset about it because I didn't want to do it, and I had made it, like 2.5 days without it, but I hadn't slept. So I did end up finally getting the epidural. And what I can tell you is that it is extremely painful, but I did like being able to move around. So that is one thing. If you get the epidural, then you're in bed. You can't get up and walk by yourself. You can't do those things. And I was really enjoying, being able to get into the bathtub and utilize the ball and move around and kind of do all those things. So that was hard once I got the epidural. So I did get the epidural because I was going to get the Pitocin, and everything had already been so intense and I was so exhausted at that point. It just felt like the right thing at that time. Um, I did a lot of research because I wanted to know, does being induced lead to higher rates of C-section? And that is correct. Especially in older moms, the risk is higher to have a C-section. So that is by the National Institute of Health. I did read a whole bunch of scholarly articles to make sure that this was correct so that I could educate you as well. So just know that if you are induced, that you do run a higher chance of having a C-section, especially if you were an older mom. So in this study, they found that 34.3% of women that were induced, about 24.8% needed a C-section. Mostly this was due to poor dilation. So that is exactly what happened to me. I wasn't dilating. And then fetal intolerance, which every time they tried to increase the Pitocin, the worse Odin got. So the more his heart rate dropped, the less he was moving around, all of that. So the Pitocin in him and the whole situation did not agree, and it wasn't helping me dilate. It didn't just go well in general. So this most commonly, all of these women were in their first pregnancies, and like I said, this is a higher risk if it is your first pregnancy, and especially if you're an older mom. The study also aimed to decrease recommendation for C-section um, doubling that with if you were induced. So they really want to help steer providers away from inducing if they don't need to. Induction is obviously not natural. They can try to repeat the process, and if it is, your baby's health is at risk and you're doing it for your own health or for the baby's or a mix, or, that's your choice, if you decide to have that done. But they are recommending that providers stop offering it as often and utilizing it more, especially if it's not necessary. So, really looking at that big picture, how is mom? How is baby? Does baby really need to come out right now? What does that look like? Is this, necessary? Because it does increase the risk of C-section. Anytime you have some major surgery, there's risk with that. You can hemorrhage, you can get infections. There's so many things to that. So I think that's really important when we're talking about induction, is that it's not just, "Oh, I'm doing this to have my baby." It's like, what are the risks associated with that? So the medications can cause issues for you, for the baby, and also the scenario can lead to a C-section. So really just the point of this episode is really to educate you on the entire process, the risks. Obviously, it can be a great thing if that's what you need. And a lot of women don't have any issues with this. Things go well for them. They do really well with it. They tolerate the medications well. So it can be a positive experience as well. I think just as a parent, as a mom, as a dad, that you just need to be well informed of what you're doing and what the risks are associated with that. And sometimes in that moment, you can just be so overwhelmed that you don't always aren't always able to see the bigger picture. So I hope that you found this episode helpful. If you have any questions or concerns, obviously you can reach out to me. Your provider is a great one to speak to about issues like this. Really having those open, honest conversations is huge for you and your baby and for your family's health. Once again, I am Natasha. This is Geriatric Mom, episode 12 on induction. If you want to reach out, I am on TikTok, I'm on Facebook, I am on Instagram. I do have a Spotify as well. I'm always open to discussion and just being supportive of you and your situation if you just feel like you need someone to listen. I also do have a website, www.geriatric-mom.com. I'm open to discuss whatever you feel or questions you might have, to go through your experience as well. Thanks for listening.